Now, if you've been getting cortisone injections and are noticing they're not working as well as they used to, it might be time to explore other options. Viscosupplementation, or hyaluronic acid injections, is often the next step in the injection therapy for arthritis. But since these treatments are usually not covered by insurance and can be pretty pricey, it's natural to wonder if they're worth the cost. So let's take a closer look at what this treatment does and what the current evidence has to say. Hyaluronic acid is a gel-like substance naturally found in your joints. It helps lubricate and cushion them, allowing for smooth movement and reducing friction between the bones. It's basically the WD-40 of the medical world. When injected into the joint affected by arthritis, hyaluronic acid is meant to replenish the natural lubrication that's been lost, helping to reduce pain, improve joint motion, and boost function. So unlike cortisone injections, which primarily address inflammation, hyaluronic acid is designed to restore and protect the joint's natural environment. These injections are often recommended for people with mild to moderate osteoarthritis, who haven't found enough relief from other pain management treatments, and who are not candidates for surgery or would like to put it off even longer. But just like cortisone, hyaluronic acid injections are not a cure for arthritis or a fix to the joint damage. They're meant to manage pain and improve function temporarily, serving as a bridge to help you tolerate more active rehab approaches. Now, you might be wondering if hyaluronic acid injections really live up to their promise. On paper, it sounds great, restoring lubrication in your joints to help them move more smoothly and reduce pain. But does it work in real life? Well, unfortunately, the research on hyaluronic acid injections has been pretty hit or miss. A lot of studies haven't shown much more relief than you'd get from placebo. In fact, the outcomes have been so underwhelming that both the American College of Rheumatology and the Arthritis Foundation have issued a recommendation against the use of intra-articular hyaluronic acid injections. This is because there's just not enough evidence to support their effectiveness. And when you compare hyaluronic acid injections to cortisone injections over a 10-year period, people who received cortisone injections were reported to have greater pain relief and were shown to be able to delay surgery longer. This is not to mention cortisone injections are a lot cheaper and often covered by insurance. But why are hyaluronic acid injections still popular, despite mixed recommendations and iffy clinical evidence? Well, it might have a lot to do with some savvy marketing and a strong direct-to-consumer push. If there's money to be made, companies are going to find a way to get it out there. And because these injections aren't covered by insurance, they can really hit your wallet, leading to big profits for those who offer them. Hyaluronic acid injections can run you $200 to $300 a pop, and since they're often sold in bundles, you could be looking at over $1,000 altogether. Now, there are still doctors that see some benefits in hyaluronic acid injections, especially for mild to moderate arthritis pain, based on their own clinical experiences and patient reports of relief. However, the debate continues about how effective they really are when studied closely. While some studies have shown small improvements, it's important to note that what is considered mathematically significant on paper doesn't always translate to meaningful improvement in real life. Now, there's another injection technique that's been getting a lot of attention lately. It's a type of regenerative medicine that uses your own platelets to help heal your injured tissues. We covered this in a video, so be sure to check it out. And if you want to keep up with more rehab-related information, don't forget to subscribe to the channel. That way you'll stay updated on everything you need to know about your body, how it works, and what it needs to keep moving.